Hello and welcome once again to Health Matters. I am Mary Alale Yusuf. Cancer is a leading cause of death all over the world, and some cancers are more common than others, but cancer can affect just about any organ on the body. The prevalence of certain types of cancers also differ between men and women, but one common thing to all types is the fast production of abnormal cells which grow beyond their borders and may spread to other organs. Leukemia is a type of cancer. It's a blood cancer. We'll be learning more about leukemia today. On the show with me is Professor Olufemi Kehinde, a consultant hematologist from the College of Medicine, University of Lagos, Idi-Araba. You're welcome to the show, sir.
Thank you.
Now, I know that I've already said that leukemia is a blood cancer, but is there a broader definition of leukemia?
No, there's no broader definition. It's certainly simply a blood cancer.
Okay.
Except that there are several blood cancers which are leukemias. Because leukemia...
There are many leukemias?
Yeah, many.
Okay, how many leukemias do we have approximately, or name some important ones?
Broadly, there is the acute leukemia and there is the chronic leukemia.
Okay. Go on.
The acute leukemia are mainly cells of the blood system which are immature, so we call them blasts.
Okay. That's the cell doesn't grow to the normal mature size or state.
It doesn't
get released into the bloodstream.
Yes, and therefore they are useless, because until it has grown to the mature state, it is known as useful.
Okay.
The white cells.
Okay.
Of the blood. There are many cells in the blood. Just the white cells is the one that are causing leukemia.
Okay, who does leukemia actually affect? Old people, young people, men, women?
Yes, it affects everybody. Children, okay, adolescents, adults, and the elderly men, everyone.
Everyone. Yes. You know, one used to think that leukemia was a childhood disease. All the films I've seen of leukemias are little children. So, what really would be the cause? I know you've mentioned that immature cells.
Yes.
Is there any other cause of leukemia?
Oh, yes. The immature cells, I said, is not the cause, it's not one that is causing it, but it's a particular type of leukemia that are immature, and that is the acute leukemia. But generally, like you have explained earlier on, that they are abnormal cells of the blood system.
Okay.
Okay? The blood system. So it then depends on which leukemia, that is, which age is it affecting. Is it a childhood leukemia? Is it an adult leukemia? Childhood leukemia occurs below 15 years of age. There is the adult leukemia, okay, certainly above 15 years of age, and there is the other type of leukemia which occurs in the very elderly, above 60 years.
But correct me if I'm wrong, white blood cells are supposed to confer some sort of immunity, yes, in the body. Yes. They fight infection.
Yes.
So if immature or whatever white blood cells are multiplying beyond beyond what they shouldn't the person be even more immune, seeing that he has more white blood cells?
Yes, but these white cells are abnormal.
Okay.
They are proliferating at their own rate, and they have normal proliferation. That condition is not good. Now, if for the acute one, they are abnormal. It's like you know dogs, puppies are useless. Suppose they fill the whole place with puppies. There'll be no other, there'll be nothing, no other. Therefore, they're useless. Now, when they have, that is when talking about the acute leukemia.
The acute one. That's the one that develops quickly, right?
No, they all develop quickly, but it occur because it occurs on the immature cells. Their manifestation are many.
Okay.
Now, one thing about leukemia is that they are multiplying abnormally in a place where they interfere with the development of the red cells.
Okay.
Where they interfere with the development of another cell, which we call the platelets in the bone marrow.
Those are the ones that cause your blood to clot if you have a cut or something.
They don't. Yes,
those are platelets.
Yes, platelets prevent the bleeding. Yes.
Okay.
So because they are multiplying uncontrollably, okay, and they are useless because there is no maturity or they are abnormal, okay. Therefore, not only that a person will suffer lack of white cells, they cannot defend us from infection. They interfere with production of red cells, which gives us energy.
Okay.
So, okay, and they also cause bleeding because they interfere with
the platelet production.
And because they interfere with production of red cells, most patients normally just come with the result of that.
Okay. So, in these parts,
yes,
what type of leukemia is more common? Or do they all happen randomly? The acute, the chronic?
Talking about children, the acute leukemia, there's a particular type that's more common.
Okay.
Talking about chronic leukemias, there's a particular type that is more common.
It's more common. You don't want to go into that one.
I can.
Well, maybe later.
Yes.
Let's go on to something else.
Maybe learn too much of hematology.
Okay, this is what we really need to know.
Yes.
What are the symptoms of somebody with leukemia?
All right. You cannot see a person for what he complains and say it's a leukemia. He has leukemia.
Okay.
What you will know is that he's sick. In fact, the signs that he will have and the complaint that he will make is just weakness, tiredness. That's all. Like any other thing.
That is pretty vague.
It is vague, but that is the way they come.
Okay, so
now, what makes acute leukemia is that the person will, without treatment, in a few weeks die without treatment.
In a few weeks?
Yes.
That's how
that is acute leukemia. Oh yes.
But the chronic one can.
Yes, the acute leukemia, they are abnormal, they are blood cells, they have not reached maturity, so they are useless.
Yet the symptoms are so vague.
The symptoms are not vague. The weakness, tiredness, unfortunately, they look vague because that is almost the complaints a person will make with malaria.
Exactly.
No, that tells you then that when a person is ill, he needs to go to the hospital.
Okay, here on the screen, there are some symptoms here.
Yes.
I don't know whether these are all correct, but you correct me. We have weight loss,
yes,
fever, frequent infections, shortness of breath. Yes. All those things can come to play.
They're come to play.
How about change in the color of the skin? Because it says purplish. I imagine that for a black man, it may not be purplish.
It may not be clear in the black man.
Yes. And then, liver enlargement cannot exactly be seen.
Yes, but the person will have liver enlargement when the doctor examine him.
How about joint pains?
There will be joint pains. There will be bone pains.
Okay, you mentioned fatigue.
Yes.
Loss of appetite.
Yes.
Okay, now you see all these symptoms.
Everything will be there, but this will not tell you that the person has leukemia.
Let me confess to you. If somebody were to come to me with symptoms like this, I probably say, "Have you checked yourself for malaria?"
Yes.
That would be the first thing.
Correct.
And what does leukemia have to do with the bones and the bone marrow?
The white cells that we have been talking about, the red cells, which are also made, which are blood products, and the platelets, which are blood products, they are all made in the bone marrow.
Okay, so that would explain why there may be some pain in the bones.
Yes. Acute leukemia actually comes with pains in the bones.
Okay, now, a major concern I have now is that a patient has all these symptoms.
Yes.
They they could be seen as having a different cause entirely.
Yes, of course.
You could think, you have an infection, or you have malaria,
yes,
or you have typhoid fever.
Yes.
Yet time is running out on this patient. How quickly can one actually diagnose that this is leukemia?
Okay. Leukemia, when a person is ill and comes with all these complaints, the first thing to think is not leukemia.
Definitely.
You have to think about the most common thing in the area in which you are seeing the person, like say in Nigeria. You have to think about malaria, okay, typhoid. You have to think about tuberculosis, okay. Not anybody that is coughing. Tuberculosis can be one of the features of this, and typhoid, and several other illnesses.
Okay, so that's the natural progression with a patient who presents with this kind of complaints.
No,
you will first eliminate those ones.
Oh yes, because why you must eliminate those ones? Because those ones are present in the area, in the like a country. Okay. If you don't eliminate those ones, you will go wrong. By the time you are going ahead to make sure whether you have malaria, you will do some specific tests which will not be necessary. That is why they are expensive. Okay? Now, by the time you have seen the patient, so your mind should be, these simple things, and you eliminate, you find out whether they are those ones. Okay? But when you have found it, then it's all right. Now, by the time you have gone into those ones, and you look at malaria, look at typhoid, look at infections in the blood, okay, and then they are not there, then you go ahead and then look for malaria. You go ahead and look for other things.
That brings me to my next question.
We're good.
Can you, from a routine blood test, just draw some blood and do a few tests, routine, like the type they use to check if there's malaria, parasites, and other things. Can one, from such a test, see that somebody has leukemia?
Yes, you can suspect.
Okay. And then go on to further tests.
You can suspect.
So it's not as mysterious as it's looking.
What can make you, if I come down more, what can make you suspect is leukemia, weakness. You will have weakness. All of these ones are due to anemia.
Okay.
They call tiredness. They mean like you can't walk very well. You can all problems. You will have that. Then too, you will have many infections. You may have kidney infection, must have abdominal infection, can have all kind of infection because of white cells that are abnormal. Now, if you don't have bleeding, by the time it has bleeding,
you will just start to bleed. No cut.
No cut. No injury. You will see him bleeding. It might be from the gums.
Okay.
By the time you see a person